Welcome back to SIROWORLD 2016. I'm David Temple, and this is an exciting moment for Dentsply Sirona and this convention. Not only do we have one of the largest, right, Jonathan, largest groups around, we're talking digital dentistry and dental education, but we've got a very special piece of news. First of all, I want to say hi to everyone. Dr. Russell Giordano, remember you from last year?
Yes, last year.
Welcome back.
Yep.
Dr. Olga Spivak, welcome.
How you doing?
Monica Schmidt.
Hi.
Hello. And Dr. Paula Suglio.
Hi.
Hi. The big news here is that one young lady at the table, that narrows it down, is the first pre-doctoral dental student to place and restore a dental implant start to finish, which is a major milestone and never been done before, right?
Absolutely.
Monica?
Yes.
Was that you?
I guess I have to step up to that.
You got to step up, girl.
Wonderful news, yes. So just last Thursday, I worked with collaboration with the oral surgery department at my school and the faculty upstairs in the preclinical department. And we worked to mill a surgical guide to place an implant for a patient who also happened to be my father. So it was a very exciting experience for myself. I learned a tremendous amount in terms of all the planning that has to take place to make this procedure happen. But it was so exciting to be a pre-doc student during this procedure. So, yeah.
So you're not a doctor yet, but when will you be?
Correct. I graduate next May, 2017. So I have one more year yet of dental school. So I actually, 1 year ago, I started up on the clinic floor at school. So, you know, the learning curve over this past year has just been very, very steep, but in the best way possible. If there was ever a time where I wasn't entirely sure what to do, I would ask the faculty, and everybody was just so happy to help me learn during this experience and to help our school in such a way that students in the future can do the same thing for their patients. So I think overall it was a phenomenal experience.
Russell, you're with the BU, correct?
Right, she's with BU. Yeah.
Okay, and what kind of a milestone, a moment, excitement does this have for you?
Well, it's great. I've actually been involved with CAD/CAM for about 30 years.
Yeah.
I've been waiting for this to happen. Our dean made the decision that we should move ahead and convert completely to digital dentistry, and our plan is to do that over the next 5 years or so. We are interested in making a seamless integration of all parts of digital dentistry. So scanning the patient's intraoral system, combining that with cone beam so that we can do these very good surgical guided implants for patients. And technology really helps us improve the overall treatment for the patient, make things more reliable for them.
Now, anyone can jump in here and talk about your experience using CEREC. So please, anyone can talk about some highlights, some of the most exciting moments of education along the way. Yes.
I can step in. I'm officially the graduate from Boston University. It's happened this May, and I'm very excited that I had the opportunity to work with the digital dentistry because I really think it is the future. And thank for our education-wise, we had the opportunity to become competent with this tool. We don't have big requirement for how many milling unit you have to do, but I was happy to admit I did 17 CEREC crowns, and also thank for our faculties who highly train and they teach us in detail. We able to not just do single units, we can work on like more advanced cases like multiple units, implant restoration, bridges. I think it's a great opportunity to have it at the school and, you know, to be better dentists.
Absolutely. And I think Olga and I actually, we both experienced using the CEREC technology in our fixed class. So I was the first DMD class to benefit from this technology.
And I'm
Olga,
my first advanced standing class.
so what that means is we were able to use the prep check aspect of CEREC to remove any type of subjectivity from grading. So we use it in our fixed course, and I think it allows for a lot more time to become available for the faculty, so they can do more one-on-one training with other students. So that, I think that's very
and I
beneficial.
can add to like my own experience when you work in simulation centers. So you work with Typodon, but you are able to work on your skills, like how to work with the camera, work with software. So when you go to the treatment center, it's really easier to start working with the patient. You really just have to adjust to work intraorally. But otherwise, we are familiar with the system. We are familiar with the camera and how it works.
And Paula, you're a graduate?
Yes.
Yeah.
I'm a foreign trained dentist. I'm from Venezuela, so I am in a clinic in UF, so to take my license. And basically, it's been a very exciting experience for me because it gave me the opportunity to be really in contact, direct contact with CEREC, with CAD/CAM technologies, and being able of planning and scanning, doing everything with the machine it's been very exciting, a very good experience.
It's so funny with Dentsply Sirona being the leading dental company in the world, right? Russell, there's got to be a little bit of a pride that you have in being able to see, as long as you've been at it, and see the progress, right?
Yeah.
And how fast it's moving.
Well, so really over the last few years, last 5 years or so, there's a large acceleration. And, you know, for a long time, people thought we were kind of a wacko a religious group who loved the CEREC, but it's involved everyone. It's very easy to do. And using all the technology together allows us to create essentially a virtual patient on our desktop. And so Dr. Patel lectured a few years ago, and you can essentially have your patient sitting right there on your computer by using the intraoral scans, the cone beam technology, see their jaw actually move into real time and real motion. And this really gives us all the information we need to come up with great treatment plans for the patient, make sure everything goes the way it should for the patient.
Really makes you wonder what tomorrow is going to be like. The big tomorrow,
Well,
right?
3D print the patient right for us, right there.
What's that?
Well, 3D print the patient's head right there for us to work on. That's next.
That's amazing. Well, congratulations again to you. That
Thank
is
you
a
very much.
huge milestone.
It is, absolutely.
And where would you like to practice?
Well, my family is in New Jersey right now. I'm considering doing a residency after dental school. So 4 years just won't be enough for me. I want to go on and continue my education a little bit further. So whether it's in the Massachusetts area or New Jersey, that's soon to be determined, but I'm looking forward to applying to residency programs.
Good for you.
next
And
year.
Olga, what does your future look like?
I'm very thrilled, but I'm starting my profession as a general practitioner in September, so I'm waiting for my license, arrive in the mail every day. So that's it. I think I would love to practice because I did have a chance to attain my first degree in Russia, so it was 5 years there. Then I was thrilled to get accepted in advanced standing program, which is another 2 years. So I cannot wait to start working.
Good for you. And Paula?
Well, I'm going to start practicing in the U.S. I practiced before in my country, so my plan is staying in Florida and start my practice there in Florida.
Perfect.
Yeah.
Well, good luck to you.
Thank
Good luck
you.
to all of you.
Thank
Good
you.
to see you again.
Thank you. Good to see you.
Enjoy the rest of the show.
Thank you.
And I expect to hear big, 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 big things for years to come. We're all in good hands. Let's take a short break and more SIROWORLD 2016 in just a couple of minutes.